Good morning, everybody. My name is Dr. Vaibhav Lende, and I am practicing vascular and endovascular surgeon in southern part of the Bangalore. Vascular and endovascular surgery means I deal with the blood vessels only, and today I am going to cover a very important topic, that is deep venous thrombosis. Deep venous thrombosis is nothing but the clotting which is happening in the blood vessels and veins, and especially deep veins. The most common organ which is involved in the deep vein clot formation is pelvis and the lower limbs, where you will see a sudden swelling in the lower limb. There will be little warmth and there will be pain, especially in the morning times, and the things will happen which is suddenly. So we have to consider one factor as a deep vein thrombosis. Usually, it happens as the age progresses in obese patients, the patients who has a lot of smoking habits, the patients who are dehydrated. These are the important causes. In a pregnancy, it might happen. Also, it can happen during the cancer disease, and when the patients are all not moving much. So those are the risk factors for the DVT. And why we have to take care? Because it can cause a dangerous pulmonary embolism. Sometime, let's say 1 to 5% of the cases, the clot might get dislodged from the pelvis or the lower limbs or wherever it is from in the lower body, and it can get in the pulmonary arteries, where the person will not be able to breathe and he may deteriorate and he may land up in the ICU. That's why it is very important not only to identify but also to treat the deep vein thrombosis. Treatment is very simple, but important thing is you have to come very fast to the hospital without any delay. We can treat it. Most of the time the deep vein thrombosis is treatable with the anticoagulation. Sometime we might require a little aggressive treatment for the deep vein thrombosis, but at the end of the day, it's up to you. You have to be healthy, you have to be little active, drink a lot of water, stop smoking if possible, and alcohol, so that you will never get this problem and you will be free from the deep vein thrombosis. Thank you.